Asperger's is an autism spectrum disorder that is considered to be on the high-functioning end of the autism spectrum. Affected children and adults have difficulty with social interactions and exhibit restricted range of interest or repetitive behavior. The cause of Asperger's syndrome is still unknown, but it is believed that genetic and environmental factors may be involved in the development. Early diagnosis is often complicated due to each individual having varying combinations of symptoms. Diagnosis in many cases occurs during adulthood. Individuals experiencing Asperger's syndrome can have a wide range of symptoms that can affect them. Some of the following are behaviors associated with Asperger's syndrome: limited or inappropriate social interactions, robotic or repetitive speech, challenges with nonverbal communication including gestures and facial expressions, which are coupled with average or above average verbal skills, tendency to discuss self rather than others, inability to understand social/emotional issues or non-literal phrases, lack of eye contact or reciprocal conversation, obsessing with specific, often unusual topics, one-sided conversation, clumsiness and poor coordination, awkward movements and/or mannerisms. Individuals may also experience behavioral symptoms that include aggression, persistent repetition of words or actions, repetitive movement, social isolation, self-harm, fidgeting, hyperactivity, screaming, impulsivity, along with anger, apprehension, loneliness, anxiety, or depression.
Asperger's syndrome is not well known to the public yet. Approximately 1 out of every 250 children to 1 in every 5,000 children get Asperger's syndrome. Most of the time, males are more diagnosed than females are. Kids who have Asperger's syndrome do not even know they have it until about age 5 or 6 because of language and speaking development. Those same children will tend to have problems socially and with communicating as they become adults. Asperger's syndrome is a syndrome that did not affect adults until the last few years. The prevalence of Asperger's syndrome is on the rise. Some patients who have a mild case tend to stay undiagnosed until they are adults. There has been no recorded adult studies of Asperger's syndrome at all. Kids who have Asperger's syndrome could also have psychiatric problems along with disorders in their adolescence and in their adulthood as they get older.
There are several ways in which Asperger's syndrome can impact a child's education. First of all, they often have excellent academic skills. Students with Asperger's syndromes are brilliant, but they typically focus on a single subject. It is a challenge for them to become interested in other subjects in school. Another challenge for these children is executive functioning. They struggle to visualize steps and follow multi-step activities. These students need organizers, charts, or visible and tangible learning tools because they are such visual learners. Lastly, they have a very low frustration level. Because self-regulation is a struggle, tantrums are very common if the child becomes frustrated, stressed, or overwhelmed. Therefore, they learn much better if they do not have a large workload. They also will become less frustrated if they have a learning routine because they cannot handle change.
Since children with Asperger's have trouble recognizing and interpreting social cues, it is difficult for them to make and maintain friendships. Asperger's makes it hard for the individual to respond to body language, expressions, and tones pertaining to the situation at hand. Those with Asperger's lack empathy, leaving them at times unable to understand others' actions or intentions. This lack of social skills can lead to the individual as coming across as insensitive or rude, when really they are just unable to identify social norms. This has caused the child to be misunderstood, resulting in anxiety and confusion in their lives. There is a greater risk of children with Asperger's to develop depression or behavioral problems. In some cases, the child can develop forms of OCD when they carry into adulthood. Depending on the severity of the symptoms and types of interventions the child receives, ultimately affects their chances at finding employment, getting into relationships, and having a normal life. When the symptoms are severe enough, they can affect the child's speech, which can result in the inability for them to communicate with others. In addition, this can impact their lives because children with this syndrome are more likely to get bullied since they do not handle social situations like others. In the day-to-day life of a child with Asperger's, change is upsetting to them, so it is important to have familiar routines and set schedules.
Children with Asperger's can easily be included in a regular classroom. Just a little extra attention and accommodations for each child will make all the difference in their learning experience. Since many children with Asperger's need routine and a very strict schedule, it is important that the teacher make their schedule down to the minute of instruction that a child knows what to plan for the day. Also, personal space seems to be of importance, and others may make their anxiety rise. If anxiety does arise, have a space in the classroom where the child can sit in his own space and relax. Have a chill out area where the child feels he or she is safe from others. Another thing a child with Asperger's might enjoy is the idea of a social storybook. This is a picture book that the child is the main character and can visually act out or think how the concept applies to them. Usually these books are based on social skills like learning how to wait your turn. It is important to have clear directions because children with Asperger's can't comprehend abstract ideas. Be clear what you want your child to complete. You may want them to show you somehow that they understand what you just told them. Since children with Asperger's usually are good at rattling off information from memory, make sure they comprehend what you just said.